Hi friends, I am sure you have seen or experienced people having pain in the neck, in the shoulder, moderate to severe intense pain, followed by weakness, difficulty in raising the arms, difficulty in flexing or difficulty in straightening the arm, or there may be associated weakness of the fingers and the wrist, as well as even breathing difficulty. This is a particular condition called brachial plexitis or Parsonage-Turner syndrome. Actually, this was described in 1948, but probably even it has been described in 1887. But it's been quite common in the medical literature after 1948, after the description by Parsonage and Turner. It's more common in males, and it's usually on the right side, and most of the time this occurs with the age from 30 to 70 years of age, but no age is exempt. Rarely it runs in families due to a mutation called septin mutation, but most of the time is idiopathic without any known cause. The causes could be various viral infection like the cold virus, the mumps, measles, Coxsackie virus, HIV virus, many viruses, many viral upper respiratory tract infection. In 15% of the cases, it's been reported after various vaccinations. So vaccination is another cause, and it can run in families. It's a rare condition called autosomal dominant familial brachial plexopathies. And the characteristic symptoms are pain in the neck, in the shoulder, or in the arm, which may be in the anterior part of the chest or in the posterior part of the back, and the pain lasts for 2 to 3 weeks or even longer, and after the pain will be so intolerable that they would keep their hands in this posture. It will be flexed here, and it will be adducted to the body. And after some time, maybe after 1 or 2 weeks after the pain, they develop weakness, sudden weakness. They would feel that they can't lift the arm, they can't flex, they can't do any activities with their hand. Different parts, there is something called a brachial plexus. Many parts can be affected, the upper, middle or lower, or maybe multiple nerves in different distribution. The end result is that they can't use their hand, they can't raise their hand, they can't flex their hand. It may be bilateral on both sides at times, or it may be initially one side and maybe later on the other side. 34% of cases can be on either sides even at the outset. So what happens after the pain? They develop weakness, then there will be wasting, there will be weakness or atrophy, there will be hollowing of the muscles in the shoulder girdle muscles, and this naturally improves after a period of weeks, months or years. Rarely it can affect the leg musculature. It's called a lumbosacral plexitis, but usually most of the cases we see a lot of cases of the upper limb or the brachial plexus involvement due to this sort of plexitis. It's autoimmune or antibody resulted weakness of the involvement of the various nerve and the nerve trunks. Okay. So what are the symptoms? Symptoms are pain, weakness, wasting, and later on after months improvement. The investigations are largely, the history is the most important, and secondly you have to look for any lesions which would infiltrate, which will damage the nerves by tumors, leukemia, lymphoma, chest tumors, or other infections, which Lyme disease for example. So we have to do those investigation. Then we have to do a certain test called nerve condition studies or EMG, electromyography, which would tell you that whether the problem is in the nerve and the plexus or in the nerve roots. I have seen a couple of patients where there have been advised surgery for the neck surgery, the disc surgery, because sometimes there will be pain there, weakness. People would they fallaciously think that it's a disc disease and they would be operated. So even now I have a patient who was advised surgery, and he came for a second opinion and found that he has got nothing but a plexal involvement. So plexitis due to pain, there is a weakness in the distribution of the various nerves. It is not in the distribution of a root. That's how after we examine we would find that what is really, whether it's a nerve, whether it's a mineral junction, whether it's a nerve and the root, trunk, plexus or the nerve roots. I mean, we have to examine properly, only then we can come to a conclusion where exactly the pathology lies. Okay. Yeah. So the treatment would be bed rest, analgesics, steroids for maybe methyl prednisone 1 gram 3 to 5 days, followed by tapering dose of steroids and analgesics and physiotherapy and supportive care. We should have a teamwork with which includes the physiatrist, the physiotherapist, the occupation therapist, physician, neurologist, and everyone should work hand in hand so that we can make a good recovery for the patient. So I would like to remind you that this condition is quite common. It can be branded as a case of cervical disc or lumbar disc, and people would undergo unnecessary surgery, which has to be avoided. That's the most important message that I want to give you. That means brachial plexitis is common. It's common in the from 3rd decade to 7th decades, but no age is exempt. It can masquerade as breathing difficulty, where it's a nerve called phrenic nerve can get affected. Some scapular nerves, suprascapular or the thoracodorsal, many nerves. Some can be winging of the scapula, difficulty in raising the hand, difficulty in flexing the hand, difficulty in extending, difficulty in using even these 2 fingers. There is one nerve called the anterior-interosseous nerve, where this can again affect it, or can be only a finger drop. So many different manifestations of brachial plexitis are known, and there can be similar plexal involvement in the lower limbs called lumbosacral plexitis, and we have to evaluate whether it is a idiopathic without any known cause, or whether it is a part of a tumor or infiltration, leukemia, lymphoma, or but those things are extremely rare. But sometimes we might find those sort of cases, but 99% is idiopathic without any major sinister implication. So let me conclude here by telling you that brachial plexus can occur, is common at least in certain seasons, and it can be largely treatable with adequate treatment, with early intervention, and you don't have to worry much. And sometimes you may have to do investigation like MRA and the nerve condition study, and some other tests like Lyme disease, ANA, or other peripheral smear and other conditions. Okay. So I hope I could give you a brief idea on this brachial plexitis. If you have got any comments, you are welcome. Thank you very much.